Imagine it's 50 years ago. It's 1966, and we're all seniors. Imagine that. In 1966, one half of this crowd of seniors was without any health insurance coverage whatsoever. So starting from this line here, all of you were expendable. Imagine that world. But now, because we have Medicare, all of our seniors have access to health care, they're living longer lives, they're living decent lives, and we are affording them the opportunity to address each and every health care issue they have. That's something worth fighting for, isn't it? Now imagine as well, it's 1966 and we're all seniors. About a quarter of you wouldn't even be here. Why? Because of life expectancy. Medicare has helped to increase life expectancy between 5 to 8 years for our seniors. Imagine that. More seniors living longer, being able to devote time to their families, to their communities, making a great difference. Who could be against that? You named it. Insurance companies and conservatives who want to deny people basic decency and dignity. Now, I'm one of the officials in California that's been charged with implementation of the Affordable Care Act. And the Affordable Care Act has a lot of good in it, but it doesn't go far enough. We have reduced by half the number of uninsured, but that still means we have 3 million uninsured people in California, and that simply doesn't mean we're going far enough. Now, the other thing the Affordable Care Act doesn't do is constrain out-of-pocket costs sufficiently. Right now, we're seeing health plans that have thousands and thousands of dollars of deductible, co-payment, and cost sharing, and it's only going to get worse. We're seeing excessive rates charged time and time again, and an inability to rein in California those excessive rates. We're seeing essential health benefits deny things like wheelchairs. Can you imagine that? Health insurance without wheelchairs, but under the Affordable Care Act in California, the essential health benefits do not include wheelchairs. They don't include hearing aids. They don't include prosthetic devices for people that have lost arms and legs. The list goes on and on. It does not go far enough. What we need to do is to take that additional step and go all the way to Medicare for all. Now, you've heard all the arguments for it. Medicare has provided health care for literally millions of our seniors. Medicaid for tens of millions of the poor. We need to take profits out of this equation. Why do you think all these companies are running after each other to buy each other? Because of the money. Healthcare decisions should not be based on profits. They should be based on what's right for human beings. Now, I want to make sure that the folks up in these buildings up here can hear us in a moment. In fact, I want to make sure that the folks back in Sacramento can hear us in a moment. In fact, I want to really make sure that the folks in Washington, D.C. can hear us in a moment. Will you help me do that? Yeah. All right. I'm going to say Medicare, and you're going to say for all. And we're going to make sure they hear us in Sacramento, in Washington, D.C., and throughout this great land, because we're not going to give up this fight until we have Medicare for all, until health care is a basic human right that all Americans and other people living in this great country can have access to. Are you with me? Yeah. All right, let's do it. Medicare. For all. Medicare. For all. Medicare. For all. Thank you very, very much.